Hey guys, welcome back to the Teach Back Method, where I teach you guys something I'm learning about in grad school to help me understand it better. For today's video, we're going to be talking about treatments for asthma and COPD. Let's break it down. Today, we're going to be talking about 6 different classes of drugs that are used to treat asthma and COPD. I know it might seem overwhelming, but don't worry, we're going to break it down. The 6 classes are as follows. We have our short and long-acting beta agonists, short and long-acting muscarinic agents, inhaled corticosteroids, and muscarine receptor antagonists. The first 2 classes we're going to be discussing are the beta agonists. The first 2 drug classes that I'm going to talk about today are short-acting beta agonists and long-acting beta agonists. They both have little acronyms just to shorten the name, so we have SEBA and LEBA. Most of the other drug classes up here also have acronyms just because this can be a mouthful. So, there's a lot of similarities between these 2 drug classes, which is why I paired them up together so you can really see the similarities. So, what do they treat? Both of them are for the treatment of asthma or COPD. There is a difference between the 2. So, short-acting is a rescue inhaler or nebulizer, and in contrast, long-acting is maintenance. So, I want you to think literally. When we're remembering the differences, just think very literally. What are we talking about? Short-acting, long-acting. So for short-acting, this is temporary, right? This is a PRN as needed. This is not a scheduled dose throughout the day. In contrast, our long-acting, this is maintenance, right? So this is something that we're doing scheduled every single day. This is not a PRN dose. Now, little sidetrack here. So when we are doing maintenance therapy, long-acting, we cannot just be using one for the treatment of asthma. So when I say that, when we're doing maintenance in asthma, we need to have at least 2 of these drugs used together. In contrast, if we are treating COPD, we are able to do just one drug. Why is that? I'm going to go ahead and skip ahead to our adverse drug effects. So if we were to use just one drug in the treatment of asthma, this actually increases our risk of death, right? Pretty serious, which is why we need to have 2 drugs together. In contrast, it is safe to use just one drug, a monotherapy, in the treatment of COPD when we're discussing our long-acting class here. So let's take a step back. What are some drug examples that fall into these classes? So you've probably already heard of some short-acting beta agonists before in your life. So we have albuterol and levalbuterol. In contrast, for our long-acting class, we have salmeterol, formoterol, and valterol. Now, you're probably seeing some similarities between the 2 classes. So all of them end in -erol. -erol, 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 -erol. So if you're taking your exam or your quiz, whatever it may be, if you see a drug that ends in -erol, you automatically know it's going to be a beta agonist, right? So from there, it's just differentiating between which one's the short-acting, which one's the long-acting. Something that helps me when I'm thinking of pairing these 2 together, already they do sound more familiar to me, right? I've heard them in life. But something else you might not have noticed, the word albuterol is actually in levalbuterol. So this can be another study mechanism. So if you see albuterol and levalbuterol together, you know they're paired up, right? Because the entire word is in levalbuterol. Now, let's talk some more about some adverse drug effects. Like all drug classes, we do have some adverse drug effects. You're not going to see these in every patient, but it is important to know. So, with our short-acting beta agonists, our examples include tremors, nervousness, palpitations, and hypokalemia. So hypo meaning a decrease in, kalemia meaning potassium. So altogether, we might see a decrease in potassium in the blood. Now, we've already talked about some adverse drug effects when we're talking about the number of drugs that we're taking in comparison to what we are doing the treatment for, whether it be asthma or COPD. So another adverse drug effect that we might see in long-acting beta agonists is actually this drug might increase your chance of severe asthma when you are having some episodes. The next 2 drug classes that I've paired up for you guys are short-acting muscarinic agents and long-acting muscarinic agents. These also have abbreviations, so you don't have to say the full class every single time. So we have SEMA and LEMA. Now the usages are a little bit similar to our previous drug class. So the short-acting is a rescue nebulizer for asthma or COPD. In contrast, long-acting is maintenance primarily for COPD. So you're not going to see maintenance therapy for asthma here, just COPD. And once again, think very literally. Short-acting, this is a short-term treatment, PRN dose as needed. In contrast, our long-acting, this is maintenance therapy, this is a scheduled dose. Now, the different drug examples that we have, the short-acting only has one drug example that we're covering in my pharmacology class. So we have ipratropium. In contrast, our long-acting are tiotropium, umeclidinium, and aclidinium. You're probably already seeing the similarities in the suffix. So all of them in umium. Umium, 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 umium. And lastly, the adverse drug effects. Like all drugs, there are some adverse drug effects that we might see in some of our patients. So, in our short-acting and long-acting, actually, they do have the same. So we have anticholinergic effects, which basically blocks the effects of acetylcholine, and then also has a bad taste. So, the adverse drug effects are the same between short-acting and long-acting. The next drug class I'm going to talk about are inhaled corticosteroids. So the usage of this class is maintenance for asthma. So we're not going to be using this drug class for maintenance of COPD. Some drug examples we have are fluticasone, beclomethasone, and budesonide. So we do have some similarities in the suffix that I'm going to point out. So the first two we do have sone, and as you can see we have nide here, but it actually does have a sone in it. So that's how I remember that third one. And then as with all drugs, this drug class does have some adverse drug effects that we might see in some of our patients, one of which being thrush, which is a fungal infection. So one way we can actually reduce the risk of getting thrush is to rinse out our mouth after we do take this drug. Next, we have an increased risk of bronchitis, that throat irritation, some coughing. And then lastly, taking an inhaled corticosteroids does put our patient at increased risk of infection. The last drug class I'm going to talk about today in the overall treatment of asthma or COPD is leukotriene receptor antagonist. Once again, this does have a little abbreviation, so you don't have to say this long phrase. We have LTRA, so LTRA. Now, the usage of this drug is asthma or seasonal allergies, so we are not going to be using this drug for COPD. Some drug examples include montelukast, Xolution, and zarfilukast. So we do have some similarities and differences when it does come to the drug name. Two of them in Lukast, and two of them start with Z. Now, this drug class does have some pretty serious adverse drug effects, so it's very important that we do have someone monitor our patients when we are taking these drugs. So we have aggressive behavior, so hostility, agitation, things like that, hallucinations, depression, and suicidal thinking. I hope you guys learned something today about the treatment of asthma or COPD. Come back to my page to learn more.